Center. Am I going back to Greg?
You're going back to me, Russ. And what did you say the forecast has
Mary.
a little more of? It has a little more oomph. Is that what you said?
A little more oomph in that weather system tomorrow. Yeah, a little more oomph.
Okay, yeah. Thank you so much, Russ. It is 9 o'clock here on Breakfast Television. Prime Minister Justin Trudeau continues his new tradition of a daily briefing to the country during this pandemic. He says the biggest variable is still how Canadians respond. He also talked about the arrival of vital medical equipment.
Last night, we received a shipment of over 1 million masks to a Hamilton warehouse. I know that people there have been working overnight to validate these supplies. This is in addition to the 10 million masks that have come in over the last days and are being distributed to the provinces and territories as quickly as possible.
And Trudeau is meeting with the premiers tonight virtually. He says the provinces are making good progress.
We need to work together to know what's needed, where and when, for communities right across the country. Provinces have been making significant progress on testing backlogs, which is giving experts important data to analyze. And we're constantly getting and validating more data. That means we can share more information with you. You can go to canada.ca/coronavirus for the latest information about cases, growth, and spread.
A look at the latest numbers now in BC. There have been 53 new cases of COVID-19, bringing the total to 1,066 in our province. 25 people have died. 142 patients remain in hospital. 67 are in critical care. 21 long-term care homes have been affected by COVID-19.
There are two major outbreaks and that we have learned quite a lot from them, particularly the Lynn Valley Care Centre. And so there is a very low threshold for testing people in long-term care, both residents and staff, and even a single staff case or resident case is treated like an outbreak, or is managed very aggressively as an outbreak.
As far as testing people for COVID-19, Dr. Bonnie Henry says BC is testing the right people, those who are more likely to have the virus and in need of help. That includes people sick enough to be in hospital or a new cluster of cases. Alarming news for anyone who has recently taken a bus in Port Coquitlam. 2 Coast Mountain Bus Company employees have tested positive for COVID-19. One of them is a bus driver. TransLink says the first employee had been working out of the Burnaby Transit Centre. The other is a POCO bus driver. Public health officials are not identifying the employees, just saying all possibly affected buses and workspaces have been cleaned and sterilized. Now, last night, a bus rider raised concerns about social distancing rules being followed on buses in the Lower Mainland. Tom Walsh has that story.
Social distancing rules being ignored aboard a transit bus. This video was taken by a passenger on Wednesday while she was on board the number 19 bus from Stanley Park to Metrotown. People can be seen standing close together, clearly less than 2 meters apart. The rider who took this video told City News she wants to remain anonymous. She says the bus kept picking passengers up despite being full.
A couple of ladies and I noticed that the bus driver was stopping at every bus stop and the bus was already full, and no stop was being requested.
Last week, TransLink implemented measures to help stop the spread of the virus, including limiting the number of available seats on buses, prohibiting standing and protecting drivers by boarding passengers through the rear doors.
The ladies and I at the back were wondering what is going on. Why is the bus driver doing this? And then we decided that I would go and inform him or ask.
But when she says she did ask, a TransLink employee refused to address her concerns and threatened to throw her off the bus. The passenger who sent us this video said the whole situation left her feeling angry and scared, especially now that 2 TransLink employees in the Lower Mainland have tested positive for COVID-19. TransLink responded to the video saying TransLink's new seating policy on buses is designed to avoid instances of crowding. We will look into the footage provided and determine how we might be able to make improvements and avoid these situations. But Karen says more clearly needs to be done, and that if TransLink is serious about their social distancing rules, they need to make sure they're being enforced as well.
It was very scary. I felt very claustrophobic, and I felt like something needs to be done, and why is it not being done?
In Vancouver, Tom Walsh, City News.
More relief is on the way for British Columbians who don't know how they'll pay their bills during this pandemic. BC Hydro is offering a 3-month credit for individual customers. This reprieve is for anyone who is short on work or out of work, self-employed contractors, and those who don't qualify for EI.
The calculation is an average of the bill over the previous year, and for residential customers, it will come in the form of a credit to be applied to bills over the next several months. In fact, during the summer, since many people's bill tends to decline, the credit may carry someone a little bit further than 3 months, maybe 3.5 months or 4 months even.
And Hydro has also reduced rates by 1%, the first rate decrease in decades, according to the province. It means most of us will save about $16 a year. If you're a Fortis customer, the province says discussions about possible financial relief are underway. Well, hundreds of thousands of Canadians right now are struggling after being laid off financially and mentally. It can be overwhelming at times and often hard to cope. Travis Prasad has more.
It's a new challenge many Canadians now face. They go to work only to be sent back home. They've been laid off because of the COVID-19 pandemic. So, how do you cope with the layoff, and how do you make the most of your time at home?
It was a little bit unbelievable.
Full disclosure, this is my mom, Debbie Prasad. She was laid off this week from a job she's been at for more than 20 years. The news was overwhelming.
How am I going to go through this? Because we're listening to all of these different things going on with the different subsidies, the government helping out, and not being on EI for over 30 years, you feel lost.
It's really overwhelming right now as people are getting laid off en masse, and so many things are going through your mind.
If you're one of the hundreds of thousands of Canadians who's been laid off, workplace expert Debbie Carew says the first thing you need to do is get a record of employment from your company. Then head to the Canada Revenue Agency website and set up an account.
Through there, you can either apply for employment insurance assistance or the new CERB benefits. That's for people that don't qualify for EI in the traditional sense.
Even though you're no longer earning a paycheck, Carew says maintaining a healthy connection with your employer while laid off will pay off.
We're seeing so many people today because they're frustrated and they're scared. They're lashing out on social media or they're saying things against their employer. And ultimately, most people are going to get called back to work with their employer, and how you interact with them and the relationship that you maintain now and how professional you are is really going to dictate your future.
But not taking a layoff personally can be tough, especially if your workplace is still open and your colleagues are still working. It's important to remember it's just business.
It's about preserving the longevity of the business and the jobs over the long term that are going to keep us all employed and keep the economy going.
While you can't control being laid off, you can control what you do with your time. My mom should be back to work in 2 months, but she chooses to focus on the now, because if there's one thing she's learned, it's that the future is hard to predict.
I just have to stay positive and make sure that I'm following what the government is asking us to do, and keeping in touch with my friends, family through social media and what have you, just like everyone else is doing out there.
In Vancouver, Travis Prasad, City News.
Frontline workers dealing with the COVID-19 crisis will be able to claim a discount at Chevron gas stations for the next 2 weeks. Hospital workers and first responders will receive $10 off their fill-up with a minimum 20-liter purchase. The discount runs until April 17th. They will need to provide professional ID. All right, it is 9:09 here on Breakfast Television. We're going to go to a live shot in Ottawa where federal ministers are making another announcement. Let's listen in.
Bonjour et merci de vous être joint à nous aujourd'hui. This is a critical week in our fight against the coronavirus. Canadians must continue to practice physical distancing. Stay strong and stay at home unless you are doing essential work like stocking the shelves of our grocery stores or working on the front lines of our healthcare system. I know that we as Canadians are resilient. Things are going to get worse before they get better, but I know that working together, we are going to get through this. Il s'agit d'une semaine critique.
This is a critical week in our fight against this virus. Canadians must continue to practice physical distancing. Stay strong and stay at home. Unless you are doing essential work, such as filling shelves at the grocery store, or if you're providing health care. Canadians are resilient. We are going to get through this crisis together.
So today we will hear from Canada's Chief Public Health Officer, Dr. Theresa Tam, le ministre des Affaires étrangères.
We'll hear from the Minister of Foreign Affairs, Mr. Champagne.
The Minister of Indigenous Services, Mark Miller. Et le président du Conseil du Trésor,
and the President of the Treasury Board, Jean-Yves Duclos.
And of course, with us today are also the Minister of Health, Patty Hajdu, the Chief Medical Officer of Health at Indigenous Services, Dr. Tom Wong, and the Deputy Chief Public Health Officer, Dr. Howard New. Dr. Tam, please.
Bonjour. Hello, everyone.
Good morning.
So, as usual, I'll start with an update on the numbers of COVID-19 cases in Canada. There are now 10,466 cases, including 111 deaths. These represent infections from previous exposures and not what is happening right now necessarily. So even if you're not hearing of cases in your community, it doesn't mean there is no risk of exposure. We must all consider that anyone could be infected, and keeping our 2-meter distance is the safest bet. So we continue to test at a very high rate in Canada, one of the highest in the world. With tests completed for over 260,000 people already. Around 3.5% of these people have been confirmed as positive, and 95% also as confirmed as negative. So we talk about these percentages. Well, what does it mean? So Canada has been maintaining around the sort of 3 to 4% positivity rate, which is within a good range for accurate detection of where the disease is circulating. The WHO, for instance, suggests somewhere between 3 to 12% even. So if we drop below this, for example, to 1% positive, for example, it may mean that we're actually casting our net too wide. We're testing a lot of people who might not otherwise really needed testing. People with mild illnesses who are not in an area of Canada where the disease is circulating, for instance. Or you're testing too early. Of course, sometimes the test is not 100%, and some people might need to be retested. But it shows that we have a very highly sensitive testing system. Of course, we are continuing to increase our laboratory capacity to make sure that that is still the case. So the number of cases and outbreaks connected to high-risk settings continue to be reported at a very concerning rate. And in particular, long-term care facilities are being affected in high numbers, and as well as reports of some hospital facilities with healthcare workers impacted. At least 50 deaths are related to long-term care homes, senior residences, and other care facilities. I cannot stress enough that we absolutely must double down to prevent the acceleration of spread in these settings. This means strict public health and infection control policies to minimize the risk of an introduction at these facilities. It also means that every one of us must take all precautions. For people who are not essential workers, this might mean staying away from long-term care facilities while finding ways to keep in touch with loved ones. Using virtual means, such as a phone call or a video, is not quite the same, but staying connected has never been more important.
Once again, I must stress that this disease spares no one. Each day, as we get additional data, We are seeing that all age groups are impacted. The consequences of this illness have been severe and fatal in older and medically vulnerable Canadians, but adults under 40 years have also experienced severe illness, accounting for over 10% of hospitalizations, with some reports of critical illness and at least one death.
Disease spares no one. Each day, as we get additional data, we are seeing that all age groups are impacted. The consequences of this illness have been severe and fatal in older and medically vulnerable Canadians. But adults under 40 years of age have also experienced severe illness, accounting for over 10% of hospitalizations, with some reports of critical illness and at least one death. Many Canadians are using their innovation, creativity and ingenuity to think outside of our bubble and help plank the curve. We need gamers, YouTubers, TikTok, Snapchat users to join our effort and spread the word to #StayHome. Thank you.
Thank you, Dr. Tam. Et maintenant, je donne la parole.
Now I give the floor to Mr. Champagne.
That was Dr. Theresa Tam giving another update in Ottawa this morning. There are now 10,466 COVID-19 cases in Canada. 111 people have died in our country. Over 260,000 people have been tested for COVID-19. Dr. Tam is reminding Canadians just because no one in your community has tested positive does not mean you are not at risk. At least 50 deaths are related to long-term care homes in Canada. For more information on this and for the latest numbers on the coronavirus, you can go to our website, citynews1130.com. We're going to take a break. We'll have more of your top stories coming up. Stay with us.